welcome to You Make the Difference. I'm Wanda Walker, and today we're talking to Brian Bergerman and Belinda Hayes. And they're going to give us some valuable information, particularly if you're around 65 or older, or if you are the caretaker for someone who is. Brian is the program manager for Three Rivers Area Agency on Aging, and Belinda is with Georgia Cares. She's the coordinator there. And we're so glad to have y'all on the show.
Well, thank you for having us.
Yeah, because I am just recently going to turn 65 and beginning to sign up for Social Security and Medicare, and have had a lot of questions, and I'm sure there are other people out there who are watching who have questions. And then I have some friends who are caretakers of their parents, and I know that they sometimes are unaware of the services that are available.
That's right.
And so this will be a program that will help you know what's out there. Okay, Brian, let's start with you and talk about aging. What kind of programs and services does Three Rivers offer?
Yeah, so first of all, Three Rivers is one of 12 area agency on agings in the state of Georgia, and we cover 10 counties, one of which being Troop. And we are part of Georgia's Aging and Disability Resource Connection. So we are considered your one-stop shop for aging and disability resources. We like to think that if somebody is needing some help, they can call us. They'll be connected with a counselor who will kind of help them navigate all the different programs and services that are in the community. So a couple of the things that we do that are, I think, that are awesome is we have access to a community resource database with over 25,000 resources in it throughout the state of Georgia. So if somebody, let's say that a neighbor says, I don't have any food and I need some emergency food, they can call us, we'll go into the database and we can give them the numbers of agencies that provide that food. But the database is massive. If you need help with income tax preparation, emergency financial assistance, if you need referrals for dental assistance or support groups, it's really a large database. So that's a really great service that we offer that's very unique. We also provide long-term care services. So we really believe that people need to age in place, and we don't want to see anybody have to go to a nursing home.
Right.
So a lot of the programs that we offer are like home-delivered meals, homemaker services, which is assistance with housekeeping assistance or errands or chores or just help around the house. And also personal care assistance, which would be help with bathing and dressing and just kind of your other activities of daily living. Again, with the whole idea of being that we want people to be at home. We don't want people going to a nursing home. And we also, one of our newest programs is assistive technology. And we received a grant from the Georgia Division of Aging Services, and we opened up an assistive technology lab in our office in Franklin. And we have over 100 different devices that will help you with your activities of daily living. So it might be something like somebody may have trouble remembering to take their medications. So there are pill boxes that have reminders that'll beep when it's time to take your medication.
Wow.
Yeah. Or if somebody's suffering from arthritis and they have trouble holding onto a normal utensil, a spoon or a fork, there are special adaptive utensils that you can purchase to make it easier to eat. So we have this great lab in Franklin, and anyone's invited to come. Just give us a call, and you can come down and see it. And it's been real beneficial for a lot of people. So in addition to the Aging and Disability Resource Connection, we also have a senior employment program. We have wellness and education programs. We have, you mentioned caregivers. We have a program called Powerful Tools for Caregivers, which teaches caregivers how to be a better caregiver.
Wow.
Chronic disease self-management programs. Diabetes is an epidemic in our country, and we teach people how to manage their diabetes and other kind of chronic health conditions. We also have a program that if somebody's in a nursing home and they'd like to transition back into the community, we have a program that can assist them to do that, and that's been really successful. We've transitioned several people out of nursing homes that were able to successfully come back into the community, which has been really a powerful thing. So what else, Belinda? What else, other programs, what did I leave out?
We have, let me think about where I'm going down the hallway here.
Well,
there's so many.
Yeah.
We cover all any kind of service that a senior or persons with disability would really be looking for. We can navigate what's available in your local and county area as well as statewide.
Yeah.
In case they wanted to move to another area, we can look for subsidized housing or help them also with if somebody's on a waiting list for services like home delivered meals, respite, all kinds of different services. If they're having to wait a little bit for the services to start,
Yes.
we can put a case manager in there to kind of see what they can do to help
That's right.
alleviate and help them out while they're waiting for the services to start. And that's
Yeah.
really a good thing to have somebody come in and really look at your whole situation and be able to talk to you about everything that might be available to give you some immediate assistance.
That's right.
Yes.
Yeah. And so, yeah, if somebody were to call and needing in-home help, they would call us, they would speak with that counselor, and we would do an assessment where we kind of assess their ability to do their activities of daily living. And then they would be put on a waiting list, as Belinda mentioned. And
In some areas.
in some areas
there's
there
not.
isn't a waiting list, and eventually get referred for services. But in the meantime, we follow them, we do updates, and if they need a case management referral, we'll do that as well.
Now, are you a government agency?
We're not considered.
We're quasi.
Yeah, quasi.
We're government
yeah.
funded as well as profit as
A
well, because we're
nonprofit?
in the regional commission.
Okay. Are you a nonprofit?
Yes.
We're both.
Okay. All right.
Yeah.
Okay. And so, do these services cost?
There might be. It really is. It's income based, so there might be a cost share in some of the programs. It doesn't cost to access the community resource database that I mentioned.
Yes.
Some of the assistive technology we can provide free of charge, but a lot of the programs it really is dependent on what your income is, because there could be a cost share or there may not be a cost share.
But they're affordable.
Right.
It's nothing
Yeah.
that's going to be costing you hundreds of dollars and you're like, you can't afford it. Really, it's very minimum, and it is for the chronic most in need. We serve that population, so there's not a high cost. It is reasonable for anybody to be able to afford.
Yes. So, about how big is your caseload?
Well, right now, we have for our different programs, for our community care service program, which is a program specifically designed to keep somebody from having to go to a nursing home. I think we have like 500 people that are receiving that assistance right now.
Yes.
So that would be 500 people that would normally maybe go to a nursing
Right.
home, which is amazing. It's keeping them safe at home. In our other waiting list, I think we have roughly maybe 50 to 100 people on that caseload.
So, how did this agency get started?
Well, it was really funded by Older American Act money back in the 1960s. That they decided that the needs of the elderly needed to be addressed, and there was
Yes.
money allotted in the area agencies on aging. If I'm correct,
Yeah,
were
started
formed
to develop,
in the
yeah.
1960s.
Wow.
Yeah.
So
Yeah.
I'm really glad we're doing this program because I was in a meeting locally, and it was of leaders in the community, and they were seeking out what was available, and we knew that there were people caring for the elderly that would not know the resources, and to think that you could call one place and learn of all the resources.
Right.
And then, I serve on some other committees in the community, like the Homeless Coalition, and I'm thinking, boy, we probably could use some of that resource information also. So is that
Absolutely.
something that we could just call and tap into
Absolutely.
those
Yeah,
resources?
Yeah. We do a lot of outreach activities, so if you wanted us to come to speak to a group about our programs and services, we'd be happy to do that, or they can call. Yeah, absolutely.
Okay,
Yeah,
all right, that
yeah.
sounds wonderful.
Yeah.
Okay, so where do people call for help?
People call for help. They call 1-866-854-5652 to be connected to a counselor. So that's-
Okay.
Yeah.
And so your office is located in
In the
Franklin?
same office.
Is
yes.
it Franklin? Okay.
Mm-hmm.
All right. Where in Franklin?
We're just off of 27.
Yeah,
off-
34 East. It's
yeah,
really right there
yeah,
in town.
Yeah.
It's a small little town. We're in the smallest town that we cover in our geographic
Yeah.
area.
Yeah.
So it's, but still, you could be in Butts, and we'll come to you. You
Right.
know, it isn't where you have to drive into the office. A lot of stuff we can do over the phone, or we'll be glad to meet you face to face in any of our areas.
That's right.
Or if you live in another area, we can link you up to another area agency on aging that can come and meet with you as well.
Yes, and that's what happened with my friend. She lives in the Atlanta area, and I was telling her that I'd heard about Three Rivers, and so she called, and then they referred her to her
Yes.
group, and she was able to call them and check out the
Sure.
services there. So
And I think it's important too. I know that you have viewers in Alabama. Is
Right.
that right? They can either call our area agencies on aging in Alabama. They can call us, and we can give them that number for the one that the county that they serve, or they can call directly to Alabama.
yeah, and they can Google it, right?
Yep. Google it.
Yeah,
Yep.
that's great.
Yeah.
Okay, so what are some of the issues or needs in our community that people are calling about?
Yeah, so we get lots of calls. Transportation is a big issue.
Oh, yes.
Huge issue. I wish we get a lot of people who call that might need transportation for dialysis or to a medical appointment, and sometimes don't make it to those medical appointments because they don't have adequate transportation. So, Troup County does have a public transportation system, but we also try to explore other ideas. If somebody were to call in, like sometimes a church may provide some assistance, or
Right.
there might be another organization that can help. So we look at other options beyond the public transportation, but that's a big issue. Another really big issue is dental care. There are a lot of people that don't have dental insurance and have tremendous issues with their teeth, and we get lots of calls. And there are some organizations that provide dental care at low cost for that we can refer them to, but it may mean traveling to Atlanta or beyond to get that help. So dental care, transportation, and food. Food is a big one. Georgia has a very high food insecurity rate. There are a lot of people that are hungry and going without food. So we get lots of calls for people that need emergency food. I don't have any
Yes.
food, and I don't get my check until next week. And also need to eat nutritious food because, as we know, a lot of people suffer from chronic diseases. Their diabetes, and so that's why we offer home delivered meals. It's a balanced meal and designed to help them. And so I think that those are the three big ones I think would be that we
Yeah.
get calls for.
Yeah, and the food banks here, or the food bank here, has been a real help with that issue. Feeding the Valley.
Yeah, feeding. We refer to
Yes.
Feeding the Valley.
Yeah,
Yes,
we really appreciate Feeding the Valley here. All right, Belinda, let's talk about Georgia Cares. What is Georgia Cares?
Georgia Cares is a trusted source that can help you with your Medicare options and choices. We're also your state health insurance assistance program, and we're listed on the back of the Medicare for You book that anyone that's receiving Medicare receives from the Center for Medicare and Medicaid, and you receive that every October.
That's great. All right, so what services does Medicare provide? Or not Medicare, but Georgia Care.
We help you with all the choices. We can help you navigate, in the Medicare for You book, there's so many choices to pick from, and you sort of get lost with all the mail you'll be receiving during that time and all the book, and you really don't know what to pick. So we can help you narrow down your choices, so we can give you 1 to 3 options and help you so you can make a well-educated choice. And we could tell you what's good about this and kind of talk to you about your own situation. That's the first thing people say, well, which one do I pick? And really based on a lot of factors. Your genetic history. Did a lot of your family have a lot of heart problems and a lot of illnesses, chronic illness early in life? So you might want to get extra coverage. And then some of you are like, well, we lived till we're 99 and didn't have a lot of health issues.
Yes.
And then you might want to get a simpler plan. So we kind of go by that. And we can help them narrow down their choices, help them read their Medicare summary notices. We can help them learn how to protect against healthcare fraud. We can help them understand when to sign up for Medicare A and B, how much it is, financial assistance, everything around Medicare. And we have strong partners, even Brian, in the community. We have really like Social Security, Medicare,
Right.
all of the large big businesses that you would go to. We can help you fill out the forms. We can help you do everything. So we're not going to just send you somewhere else and say you just go see them. We can help you make those connections, make those calls, do the applications for you, fill out the forms. So it's very easy for you to understand in layman terms too. We will meet you on a one-on-one basis as well.
Yeah,
And it's a free service.
Yeah, that's so nice to have somebody explain all that to
Yeah.
you. Because you get lots of phone calls, you get lots of mail, and it can be very confusing,
Yes,
right?
yes.
Now, talk just a little bit about Medicaid fraud.
The Medicare fraud
Yeah.
in the health care,
Yes, sorry.
Medicare.
Yeah.
It a lot of times you need to protect your Medicare number just as well as you would your Social Security numbers or your credit card numbers. You know, healthcare fraud loses like $60 billion a year. So it's very easy for someone to get your identity and they can go to the doctor and get services. So you want to protect those numbers as well to help alleviate any kind of healthcare fraud, because that is a big issue.
Yes. And so what about all these calls that you're getting? Do you have to be careful about that?
Yes. You never want to get out information over the phone to anyone unless you've initiated the call yourself.
Okay.
Yes. And you never want to call them back using any kind of numbers that they provide. You want to look it up yourself and call the companies yourself.
Yes.
Yes.
Okay. All right. So, what are some of the problems with those companies calling you? Are some of them out to charge you higher rates, or what are the things that you have to be careful about?
Well, you never want to really talk to somebody over the phone you never know and provide information for them. You really want to go to a trusted source, either Medicare directly or Georgia Cares. Very trusted, we're very connected, and you know, if you give out information to people you don't know or over the phone, you really don't know. There's so many scams out there, and it's so easy to be scammed.
Yes.
And so you really want to do your research and call one of the government agencies or a trusted source that you have right in your community.
Okay. Now, tell me what number of people can call for your services.
The number you would call directly is 706-675-9031.
Because a lot of that information is really hard to digest. Even just signing up for insurance under a group that you've already signed up with, sometimes it's hard to understand everything that they're telling you in those manuals, and sometimes the manuals are that thick.
Yes.
And to try to maneuver all of that is really difficult. So it's so nice, and we're so glad that there are agencies that can help all of us do that. Okay, so tell me about the Medicare financial programs.
Medicare, of course, costing you like $134 a month for your Medicare Part B insurance. So there is financial assistance for people to help pay that Medicare Part B premium, as well as to help you with any kind of drug plan or medication coverage. And it can run anywhere from like $1,032 a month or below if your income is within that range to get that financial assistance, all the way up to $2,078 a month for a couple. So it all depends. You know, you can call us and we can do the screening for you. We do the applications with Social Security and with the Department of Family and Children Services. We do that right online.
Okay, and so now tell me how that works.
The financial assistance program.
What benefit would that be for me?
It could pay your Medicare Part B premium for you,
Okay.
as well as pay a certain amount of your prescription drug coverage and lower the cost of your medications down anywhere from like $3 to $7 a piece.
Okay.
Yes, and that's very helpful.
Okay, well, when is open enrollment?
Open enrollment is October the 15th through December the 7th every year. And that's for people that have already been on Medicare for a while and they might want to change their options or look and see what the new plans are going to look like starting in January.
Okay, so why should people compare those plans?
Because it's very important to do that, because you might be on a plan now that costs you like $20 and you could be paying $15 a month for your medications. But they're very competitive, the plans are, so you always want to look, because in January Your plan could be, you could get one that's zero, and your medications could be free. So that's a big savings if you look over that over a whole year period of time.
Yes.
As well as some plans will change and not cover certain medications starting in January, or either they're not going to be in your area code anymore. It's based on zip code. So you always want to look and make sure that you're on the most cost effective and all your medications will be covered and you're still getting the best coverage that's available starting in January.
About how many plans are there out there?
Oh, they change up every year. It could be 20, 30 plans, or it could be
wow.
less. You know, it used to be a
Yes.
whole lot. The book used to be really thick.
Yeah.
And it's really thin now, so, because it started out being very competitive and there was a lot of different plans. So it depends. Every year it's sort of different.
And so open enrollment, you get to change every year what you want to take.
Yes.
All right, so you have to study that book again. And so
Or you could call Georgia
or you
Cares,
could call Georgia
and
Cares.
we'll go on the Medicare.gov website.
Yes.
We don't use, independent. We'll go on the Medicare.gov website, put in your medications, as well as your geographic area, your zip code, and it will bring up some top choices based on the most cost-effective plan for you. Then we can discuss those with you. Which one do you want? Do you want an Advantage plan that covers like an HMO or a PPO, or do you just want a drug plan?
Yes.
And just have original Medicare. There's 3 different options, and we kind of narrow that down through discussing how much can you afford to pay and how much insurance would you like to have based on some health issues, with family history.
Yes. Well, that's a wonderful resource. All right, so what do we need to know about the new Medicare cards?
New Medicare cards. Social Security is removing the Social Security number off of your Medicare cards across the United States. So what they're doing is they're mailing them out in batches, and they're going to mail them out to individuals. Like if you and your husband both have Medicare, they're not going to mail them both at the same time. They're just going to randomly mail them out. And anytime after June, they're going to start mailing them out in Georgia. So start looking for those. When you receive your card, all they're doing on your Medicare card, it'll be a random number with some letters in it, and you'll just sign it, and that'll replace your Medicare card. Every insurance company that you have, they will be notified behind the scenes. You won't have to call them and give them your new card number. But when you do get your card, whenever you go to the doctor or the hospital next, you'll just present your card. That way they'll be able to bill your Medicare adequately and be able to meet those financial needs.
Yes, and if somebody has Medicare and a supplemental policy, are they pretty much safe in having their medical expenses covered?
You're talking about one of those HMOs, PPOs?
Well, I don't know. I just mean in general.
Well, there's 2 ways you can do it. Either you can have an Advantage plan, and that's like HMOs and PPOs. We have copays when you go to the doctor, and you have a daily rate when you go into the hospital, and you have some out-of-pocket cost. But you can have that, and it's kind of easy when you go to the doctor and you know what your copays are if you go to the emergency room. But you have to, not all doctors will take it. You have to go to the doctors and hospitals that will take your card, or in the network. But, you can do your research and make sure that your doctors and hospitals will cover it. And if you go to one doctor down the street and that's the only one you go to and he accepts it, and you make a $25 or $10 copay, or you're happy with that. That's easy.
Yes.
Or you could just go with original Medicare. Medicare covers 80%. You pay 20%, and of course you've got deductibles on your A and B when you go into the hospital and when you go see the doctor once a year. But you're out of pocket there. And then you could pick up a Medigap that pays that 20% that Medicare doesn't cover, and it'll also pay your deductibles as well. So that's why you can go to any doctor that'll take Medicare, and Medicare is United States wide, and so you can go to any doctor that'll accept Medicare.
So some don't.
Some don't.
Wow. Okay. All right. So the Medigap policy. When do you take that? I mean, that's different than having a supplemental. Explain the difference in that.
Well, the supplemental that you're referring to is the Advantage plans.
Okay.
Those are like your HMOs, PPOs,
Okay.
those kind of things, with your copays. And the Medigap pays after Medicare. Medicare's primary. It picks up the difference that Medicare doesn't cover. That's why it's called a Medigap. It picks up the gap that Medicare doesn't cover.
Okay, and so does it pay in full?
Yes, it can pick up that full 20%, and there's different options for you as well. They usually start out like $120 or something. They kind of go up, and they are age related, so the older you get, the more costly they are. But it does give you good coverage, and you can use your original Medicare. But of course, if that's not in your financial budget, then it's easy for you to just switch over and just have an Advantage plan where you just make your copays.
Okay.
So it depends on your financial and what kind of coverage you would like. Do you travel? You might want to get, if you go on cruises all the time, or you have a home in Colorado, you might be better to have a Medigap. That way you can have that coverage when you're out of state.
Okay, so if I have Medicare and I live in Georgia, but I go to California and something happens to me, does that affect?
If you're on a HMO, of course you can just go with emergency. You have to stay in network. So that might narrow down your choices a little bit to have that wide coverage, especially on a cruise ship or anything like that. You won't have that coverage unless, of course, you purchase extra travel insurance. But with the Medigap, sometimes those will cover on your plan. They'll cover cruise ships and out of the country and things like that.
Yes, okay. So do people need to look over their summary notice or eligibility of benefits?
Yes, they do. You receive those every 3 months, and it's very important to read those because that is what someone is charging against your Medicare. And you always want to make sure the services that you receive on Medicare is something that you received and not someone else getting your identity. Because let's say somebody got your health insurance information, they went to the doctor and had a pacemaker put in. Well, that's something that they're not going to do 2 or 3 times a year.
Yes.
So if you need a pacemaker and somebody else has already got a pacemaker under your insurance, you might not have the coverage as quick as you want it. So you want to be able to read it and say, I had this service and it was something that I went to that doctor. Like, yeah, I've never been to California, and I see where a doctor in California charged my Medicare for a service.
Yes.
And so you want to get that cleaned off of your record and make sure the health services that you received was something you needed, because it's for you.
Okay, and so really quickly, can you tell us like the preventative services that are covered under Medicare?
There's a lot of preventive services, help you not smoking, help you with vaccinations, as well as heart screenings, cancer screenings. So there's a lot of preventive services that is free, annual visits that you're able to obtain and get when you receive Medicare.
And do you get silver sneakers?
Some of the plans do, and those fall under your Advantage plan.
Okay.
That's not under original Medicare. Sometimes the Advantage plans, those HMOs, PPOs, they cover like little dental coverage as well as glasses or vision coverage that Medicare doesn't cover.
Yes. Well, I want to thank both of you for coming.
Oh, you're welcome.
And I want you to give your phone number, really quick again.
706-675-9031.
And Brian?
866-854-5652. And we can connect you to Belinda
Yeah,
too if
same
you call
thing.
us.
We're in the
Okay.
same office.
All right. We just want to thank you for watching You Make the Difference, and we hope that you have discovered some things that you didn't know that will be helpful to you. And we appreciate you watching, and we'll see you next week.
Got a promise from heaven. It's a year of replevin.